Hello, guys. I am Carla Calderas of Calderas Counseling, and I'm a mental health therapist here in Texas. It is a licensed professional counselor. And today we're going to be talking to you about some typical questions that we get when clients call us.
Hi, and I'm Erin and I. I'm a licensed professional counselor intern.
We see clients as young as 10 years old, so we typically say preteens or teens. We see individuals struggling with depression and anxiety, and we also see couples.
It's hard to say that I have a typical client. Every client that we see is very different. Um, but some types of clients we have are teenagers suffering with anxiety or depression, um, marital couples who are wanting to work on building communication or learning how to fight better and fight in good, healthy ways that build intimacy. Um, we also have clients that suffer with trauma.
For me, I see a lot of teens who are struggling at school, maybe struggling with low self esteem, being bullied, who are really stressed out because of testing. And I also see a lot of stay at home moms who are just stressed out, tired from everything that goes on at the house, husband keeping the house clean and their kids ready and taking them to places. So a lot of moms struggling with depression and anxiety, and I see some couples. The first session is different depending if it's for a teen, for a couple, or for an individual who's an adult. So I'm going to tell you what it looks like for a teen, and then you can take and explain the other one. So for a teen, the first session is typically with parents and the teen. I bring them back, we sit here, I explain confidentiality, I ask them some questions, we go over the paperwork that they filled out online, and the majority of the session is spent with the teen. I ask the teen some questions. It feels kind of like an interview, and I explain that at the beginning. I am typically on my computer, and that's something that I explain to them. Hey, I'm going to be using my computer because I'm going to be taking some notes, but this is the only time that you'll see me on the computer. Moving forward, I'm just going to be totally engaged and looking at you and talking with you. So I ask the teen some questions as I'm taking some notes. We talk a little bit about treatment plans, so what they're envisioning for counseling, what they want to focus on, what they want to learn and get better at. And then I bring the parents back in, talk about treatment plan, and go over some paperwork, so some policies and procedures.
Um, Individuals and most of the time couples as well. The counseling, the first session looks like bringing them in, going over paperwork, going over consent, informed consent, which talks about limits of confidentiality. And then I just want to get to know the client and what they came to counseling for and what their goals are and how we can start envisioning a treatment plan to work on those things.
Yeah, so the typical first session, it feels different. It's going to be kind of like asking a lot of questions, paperwork. So it's not going to feel like, wow, I just learned this new thing today. So that's something that we'll get on at later sessions. So the first session is different in that sense.
Following that first session, clients are going to begin the work that they have set their goals for. And so that may mean working on negative thinking, it may work on understanding emotions. Um, it's a continual evaluation process of what the client needs. Sometimes clients just need to come in and talk. I tell them if there's a day that you come in and say, I just need to get it out, they come in and they talk and they process what's going on. And there are some days that they come in and they're like, I need these coping skills. I need skills to deal with the things that the symptoms of anxiety or depression. Or with the couples, we work on communication. And so we start laying that foundation of coping skills and of social skills that clients need to improve and to move towards their goals.
So for teens, so preteens, clients who are minors, The first contact is typically with parents. They're the ones calling and scheduling the appointment. So that's my first contact with. And then, like I said before, they come in and they are involved in the first session. And then moving forward, it depends. There is confidentiality, so we cannot tell the parent what the teen is telling us. And we can give them some help or an overview of what's going on, but we wouldn't be able to say, hey, this is what your teen is saying and this is what's going on. And then with that, I sometimes recommend parent sessions. And those can be as soon as after 2 sessions with a client, I recommend a parent session, or sometimes I go 5 to 6 sessions with a teen and then recommend a parent session. So let's say I do end up having a parent session. For that session, I have sometimes a handout, and this says like the skills that I've covered with a teen. So it can be like coping skills, emotional regulation skills. So it will be things that I've done with the teen and not what the teen has told me. I will have other information pertaining specifically to your teen, and you have an opportunity to ask questions, to talk about how goals are going, things like that. And then depending on parents and what the teen is disclosing, I sometimes have a handout and then we discuss parenting skills. So it can be things on how to better communicate with your teen, how to improve the communication with your teen, how to help them improve their self-esteem.
So I use a wide range of therapeutic techniques. When we were in school, we learned that that was kind of an eclectic approach to counseling. And I do that because I think every client needs something different. Some clients need encouragement, some clients need more support. It just depends on the client. So, one thing that I use is cognitive behavioral therapy. And cognitive behavioral therapy is understanding and how to identify your emotions, understand them and how they affect your thoughts, and how those thoughts affect your behaviors. And another thing that I use is EMDR therapy for clients who are dealing with trauma. It's been shown to be able to be used with OCD and even anxiety as well. And basically, it is a form of therapy used to treat difficult, painful, emotional memories and that are still affecting the client today. And then I use Gottman therapy as well. Me and Carla both do Gottman therapy.
Yes, so the Gottman method for couples therapy is something that we use for couples. So when working with couples, we use that. And then for me, with individuals, I do a lot of cognitive behavioral therapy, like Erin. So recognizing your thoughts, your negative thoughts, and reframing them for positive ones. And then I also use existential theory. So trying to find purpose in the things that are happening to you, purpose into your life, and what it means to be alive for you and where you want to go. Thank you for watching, guys. Please let us know if you have any questions. You can comment down below or you can send us an email at info@calderascounseling.com. Also, feel free to check out our website and our social media. You can look down in the description box so that you can follow us and read the blogs that we post or motivational posts that we post. And let us know if you have any other questions about therapy and what it is, and we'll make sure to record a video about that too. Have a great day. Thank you.
Thanks.